Welcome back to the Disaster Podcast here in Atlanta, Georgia at the Disaster Preparedness Summit. We're glad to have you back. We have one thing we haven't touched on yet is the issue of mental health and how we handle that. And certainly in a disaster, that's going to be a very necessary resource, but also on an everyday basis. So we got three folks here from New York, and I'm just going to have them introduce themselves. So Melanie, tell us about what you do.
My name is Melanie Averett. I'm part of Here to Help Connect. We ran the call center for Project Hope, which was the response to Hurricane Sandy. We were the crisis call center, so we handled all the incoming calls and then connected to people struggling with emotional distress and provided them on the ground help and outreach for anyone in emotional distress.
Excellent. Yeah. And Joe, tell us about yourself.
My name is Joe Samlin. I'm the Outreach Manager nationally for the Disaster Distress Helpline, which is a national resource for disaster behavioral health, so that anyone, a survivor, a responder, a loved one of a survivor, of a victim of a disaster, can reach out 24/7, 365 from anywhere in the country through phone or text to be connected to a live crisis counselor that can provide crisis counseling and support and a lot more to them.
And Christian.
Yes, Christian Burgess, and I'm director of the Disaster Distress Helpline. So Joe said it all about our project.
Well, and you're making me realize, there's just so many different levels of need. As a part of a disaster medical assistance team, we're not going into the best environments. Some of us went to ground zero. So, and interesting, that was part of my role with my team, is looking out for mental health, and I'm basically a peer counselor level. I'm certainly not at the level probably most of you are, but so you have the responders, you have the people involved in the disaster, you have the first responders in the field, you have victims as well as their families. So there's just a huge variety of people. Nobody's unaffected by a disaster.
Exactly, and that's one of the key principles of disaster behavioral health, is that when disasters occur, no one is untouched by it. Clearly there's a spectrum of impact depending on the size and scope of the disaster as well. The Disaster Distress Helpline, as a national crisis hotline, we're meant to be a 24/7 resource for crisis counseling and support for any large-scale natural or human-caused disaster, particularly ones that occur where the impacts are actually outside of the immediate area. It's a resource for local communities impacted by disasters, but SAMHSA, our funder, our federal partner, Substance Abuse and Mental Health Services Administration, actually created the project 2 years ago because there was a need to ensure that everyone in the United States and territories would have access to this 24/7 crisis counseling and support. And that's the role that crisis hotlines play in general at the local, state, and national levels. We're not brick and mortar bound, and we're staffed by trained crisis counselors who provide support, crisis assessment, intervention and referral to those individuals that you were describing. And again, it could be a spectrum. It could be survivors of the disaster who are living or working in the area at the time of impact. It could be their loved ones who are in distress and concerned about their well-being, their loved ones' well-being. It could be loved ones of victims, and first responders, rescue and recovery workers. And with that category, we actually look at that as more than the police officers and firefighters and hazmat workers, and the people who are on the front lines clearly are at risk for emotional distress as well.
Absolutely.
But it's everyone from the K-9 units to the people who are staffing the relief centers for first responders. And we see that with first responders in particular and rescue and recovery workers, because you're doing these deployments for hours on end, and you're away from your family or away from your traditional supports. And another thing I think that we see with responders in particular is this category of folks that we target with our services, is that there's this code of honor where you go, you do your duty, you're supposed to be, you're not supposed to show stress. And that's one of the...
We hide it well.
Yes.
You hide it well.
But what happens when you get home?
And that's one of the things that we want, one of the messages that we want to relay with our services, that they're confidential, they're meant to be resources for people to just talk about what's on their mind, as well as if you might be experiencing more significant levels of distress that might indicate more serious mental health concerns like depression, persistent anxiety, suicidal feelings, substance abuse, which is an issue that many first responders
Yes,
also
it
may
is.
face after exposure to a disaster, and particularly long deployments. And so we're also a resource for that. So it is important for us to speak about the impacts on first responders as well.
And you bring up a good point, being one of them. I'm very well aware of this. This may not be something that we want to discuss with our own people. You know, it's like, we're all A-type, we're all macho. So I'm not going to talk to my partner about this. He'll just think I'm a wimp. So but I still have the need to talk to somebody. So this way you can find an impartial person who understands what you're talking about without, letting it out to everybody. So I think that's a valuable part of this.
I think that's a great point, Sam, and I appreciate that. And for some folks, it is the culture, whether it's a macho thing, an old boys network, all the above. I was a firefighter and volunteer
There you go.
EMS as well, upstate New York, so I know it well. In addition, though, there's other concerns in terms of, what will folks think of me next time we go and deploy?
Does this
Will this
make me
affect
weak?
my job?
Yeah.
Right? Those are the kind
Right.
of concerns, whether it's law enforcement, military, et cetera. And I think also, a lot of times we think about responders and survivors and those affected. And at the same time, we know that very often those are also the same group, right? A lot of the folks, the Sandy responders from New York, were also folks whose homes were affected, fire in Queens, or
was
the
there.
flood damage, et cetera. So I think it's important to remember that as well. And that's one of the key things about having now with the Disaster Distress Helpline, a 24/7, 365 service allows for, if it really hits you 6 months after that deployment, right? Or 6 months later and your home still, the mold is not remediated and it's still, then that can really add up and you hit that cumulative stress, and we're still going to be
And the
there.
financial stress.
All the pieces.
Oh,
absolutely.
that right there is enough. But when you said SAMHSA, it reminded me, someone told me recently about a SAMHSA app,
Yeah.
which is good for people like me that kind of work in that realm. And I honestly haven't taken a lot of time to look through it, but there is an app out. There's an
is.
app for that.
They just released
that
it.
gives you some really
Yeah.
nice information.
It's exciting. It's a disaster behavioral health responder app, and if users go to their Google Play Store or their Apple Store, and it's also available
I've got
for
it.
BlackBerry on the App World. They're working on a Windows platform version as well. But if they go to that and type in the keyword SAMHSA, that's SAMHSA, disaster behavioral health, they'll find it. And it is a free app that can be downloaded to your smartphone so that responders have immediate access to, particularly to crisis resources, because responders have intuition and they have skill in the area of being able to assist people
Right.
with their emotional reactions. And oftentimes that helps them to respond in a disaster if they know how to approach someone and talk to someone who's in distress. But responders aren't expected to be mental health workers or disaster behavioral health responders themselves, and so this kind of app can be helpful because at their fingertips they'll have resources that they can connect survivors with for follow-up care and support. Not only just the Disaster Distress Helpline, but they also have a feature in the app that's embedded in the app called the Treatment and Referral Locator, which will actually, by zip code, locate an area clinic or mental health center where survivors can go for face-to-face services. And that's a unique feature of this because you can actually key in a person's zip code and look that up. And it has information about warning signs of distress. It has information on healthy coping, important information that the person who's using the app and who's in the field, whether it's on site at a scene or in a shelter or in a family assistance center, it's information that you can give right then and there to somebody who's in distress.
That's excellent, because as first responders, and Joe would know this, that you see people that are sick and they're injured, but when you have someone who's sick and injured and just lost their home and their family floated away in the water and they don't know what their outcome is, that's a whole different story. How do you take that home with you? And you never really know the outcome of these people. That's what makes it really difficult.
The importance of a 24/7, 365, I think, on the hotline. In the beginning, we heard a need for the concrete services, and that's what you're saying. But 6 months, 8 months, 10 months,
Right.
and now 18, 20 months later, we are seeing the need. Yes, I've gotten some services, but now I'm starting to feel, the other day we got a call that children are still being affected by the sound of a shower and being still afraid for...
That's we could do a whole podcast just on the
But there's a need.
child's reaction to a disaster.
And they're actually
that
considered a
sometimes gets
high-risk
missed.
category for distress,
Definitely,
for emotional
because
distress.
when the parents are so involved in their own reaction, they sometimes don't see things that are, and kids tend to take blame on themselves.
Sure, and kids are resilient, but they also they're not quite as equipped, obviously, with how to process the information that literally comes at you in a disaster, the chaotic nature of disasters, or even just the loss that's associated
Yes.
with disaster.
But it's an interesting thing I learned about kids. A friend of mine, when we were at Ground Zero, there were all of these cards that these kids sent, mostly as a school exercise or something, and he actually took them and created a presentation around their reaction and their numbers of reactions. But one of the things was kids want to always normalize something.
Right.
And they're telling us, hey, why don't you take a break? Why don't you, go see your family? I mean, they were much smarter than we were on a lot of levels, and we weren't listening to them.
Yeah.
So I always think about that when
I want to mention, just real quick, with an important facet of the National Disaster Distress Helpline is that we're actually a network of crisis centers around the country. We're affiliated with the National Suicide Prevention Lifeline. We're in the same family of services as well as the Veterans Crisis Line. So we carve our network out of the National Suicide Prevention Lifeline network. We have 6 crisis centers in our network around the California and LA and
Good.
Houston and Orlando and Denver. And actually, Here to Help Connect is one of our crisis centers in New York City. So they're New York City's crisis information and referral line, and they're a crisis center for the National Disaster Distress Helpline. So they're taking calls not only
Yeah.
for New York City but also the entire country.
Well, Melanie, tell us, I'm going to want you guys to all give
Sure.
us good resource information and how people find out about this valuable resource. And I'm sure when we're not in the middle of a disaster, you just have other good information to put out to people too,
Yeah.
like just,
And we're affiliated with the same organization.
Yes.
We're a program of the Mental Health Association of New York City, which has been around for over 40 years, providing services, support, and advocacy for New Yorkers living with mental illness. And they actually created Link to Health Solutions, which is the division that oversees the Disaster Distress Helpline in 2005, the year that Hurricane Katrina hit, actually. That's when the Lifeline started. But it's an important thing to understand about MHA, and the reason why SAMHSA partnered with MHA is because our experience with 9/11. LifeNet was the point of contact for survivors, first responders, and others impacted by the September 11 terrorist attacks. And it was that experience. And LifeNet was actually identified as perhaps the single most important mental health
Excellent,
aspect
yeah.
of that response. And so that's one of the reasons why SAMHSA ended up partnering with us to create a national network of crisis centers.
well, it's nice to know even now because people, I mean, I know responders that are still feeling the
Yeah,
effects.
sure,
and,
absolutely.
I'm one of them.
Yeah.
So it's nice to know if it ever gets that, you
Yeah.
have that resource.
It's a journey. Recovery is a journey.
It absolutely
Yeah.
is. So Melanie, tell us more about how they could find out.
So in New York, it's LifeNet, but it would be MHA NYC
MHAofNYC.org
would be
is
the
website.
resource that people can find, and we answer a number of lines. I think we're up to 14 different lines that we answer, including LifeNet,
Wow.
and
Just have a lot of people.
we have a lot of people, actually not as many as you would think. We have a lot of remote workers, which is great during a disaster. Actually, during Hurricane Sandy, we were only offline for about 2 hours
Excellent.
because we were able to still answer calls remotely due to our team. So that was great.
Excellent. Joe?
Go ahead. No.
I think one of the key pieces for me is really now that there is, and DDH, the Disaster Distress Helpline, is a unique resource in that it is available. It doesn't need to be activated. We're always available. And that means we're a resource for everything from before, during, and after disasters. So preparedness and mitigation activities include our information as well as your local disaster behavioral health resource information in go bags when you're doing preparedness, mitigation. Through pre-impact with Sandy, we see a lot of calls and texts who are really concerned about the media coverage of super mega death Frankenstorm Sandy and Run for the Hills
Yes.
and that kind of media coverage, which raises levels of distress usually.
Oh, absolutely.
And so pre-impact, impact, rescue response, and long-term recovery as well. So for us, the creation and existence now of this national resource, the Disaster Distress Helpline, really can be a prompt, whether it's a local medical team, whether it's a national agency, whether it's a CERT, whoever it is, any kind of role you play in disaster work, use the existence of the Disaster Distress Helpline as a completely free resource. We can send you all materials
Free is
for free
good.
for your agency
Yeah.
to call or text us because our crisis counseling is done through phone or through text messaging live.
Which is actually a really interesting part of our service that we could do an entire other medcast on.
Well, we may have to do that sometime.
And I do want to emphasize that viewers can go to disasterdistress.samhsa.gov for more information and as well as to download the materials that Joe was mentioning. That's disasterdistress.samhsa.gov. And on our website, you can find links to other resources for emotional care and support, free brochures to download, et cetera. And what Joe was saying, too, about the importance of addressing mental health throughout all phases of a disaster is really, it's one of the reasons why we're here at the Public Health Preparedness Summit, is to drive that point home, that it's not just about the recovery phase, it's also about preparedness, response, and recovery. And we really want to bring in all of these other stakeholders to this conversation.
And
Wow.
collaboration.
Yeah, excellent information, and we want to make sure we point people to you so they can learn more about it. Well, here we are again, wishing I didn't have to stop, but I do because Jamie's looking at me over there. So this will be the end of this disaster podcast. We hope you listen for more. We again appreciate NACCHO bringing us here to Atlanta to this disaster preparedness conference. And as we say, disaster medicine is not everyday medicine, but we know now that disaster preparedness is everyone's responsibility.